I found that the patient's acceptance of the LANAP has been unbelievably positive. I, I, when I say that I don't have to use a scalpel, we don't have to do sutures, they're like, oh, this is wonderful. And the only complaint I get from my patients is, oh, that liquid diet that I had. I mean, and that's really, I mean, post-operatively, they have minimal pain, minimal bleeding, and when you see the patient the following week, things look really, really nice. And you don't typically see that with traditional surgery. And now that it has the FDA approval for regeneration, if I have patients that have vertical defects and bony defects, I say I can do a procedure that doesn't involve extra materials, which is bone grafting and membranes. So it's going to be more cost effective for you because it's just a surgical procedure. And that has also been very positive for the patients. And one other thing that I find very beneficial is, in perio practice, we tend to see older patients that are on a lot of multiple meds, a lot of patients on anticoagulant therapy. And these are people that require a lot of management if you're going to do traditional surgery. And it's not as significant when you do LANAP. The big difference is I spent my career in the military. And by the time I was in the military, the only service that actually had the Millennium Laser was the Army. The year I retired from the military, the Navy picked it up. So I didn't get any real training in it. And I would frequently go on our AAP forum, and there was a lot of discussion about the laser. You had like a very pro laser camp and a very negative laser camp. So I just kind of, read about it and kind of did a little research. I talked to colleagues that I trusted. One was a former instructor I had when I went through my Navy program, and one was a Navy periodontist that had gotten out in the civilian world. And I really valued their opinions, and they really kind of put me over the edge. I said, you need to try it. This is a wonderful adjunct to your profession and your practice. So I decided to do it, and still a little anxious when I went to boot camp, but then when I got it and started using it more, I went through my day 4, and I really feel now I'm really comfortable with using the laser, and I feel comfortable, discussing everything with the patients, and so it's been a very positive experience for me.